Good morning. I'll be presenting Sequalae and management of radiation-induced complications in retinoblastoma. I have no financial disclosures. So the purpose of our study was to discuss the post-radiotherapy complications in patients of retinoblastoma. It was a retrospective analysis of treatment record of retinoblastoma eyes treated with radiotherapy from January 2004 to May 2024. Treatment record of 14 eyes of 14 patients was analyzed on following parameters: the age of presentation, the laterality, the family history, international classification of retinoblastoma, complications, and how we manage them. So coming on to the results, foremost, there were 2 patients which were unilateral retinoblastomas and rest 12 were bilateral cases of retinoblastoma. Family history was present in 4 patients of retinoblastoma and absent in 10 patients of retinoblastoma. Coming on to the classification, 6 patients belong to group B, 3 patients belong to group D, and 5 patients belong to group E. So 12 patients who received radiotherapy as a primary treatment modality, out of which 6 patients were from group B, 3 patients belonged to group D, and 3 patients belonged to group E. And 2 patients in group E received the post-enucleation due to choroidal invasion and optic nerve involvement in the enucleated sample. 9 out of the 14 patients received low dose of chemotherapy that was less than 35 centigrays, and the rest received high dose radiations. Coming on to the complications that we encountered, so the most common complication that was occurring post-radiation was the presence of post-radiation cataract. It was present in 7 of our patients, and all of these were managed with phacoaspiration, with posterior chamber IOL, with anterior vitrectomy, and primary posterior capsular excess. Radiation retinopathy involving the macula was present in 3 of our patients. All of these were managed with three doses of intravitreal anti-VEGFs, that is ranibizumab. Secondary tumor as a meningioma was present in 1 of the patient, which also had a family history and underwent neurosurgical intervention for the same. There was presence of contracted socket post-radiation in 2 patients, which was again managed on serial dermis fat grafts and fornix forming sutures, and a serious complication of growth retardation was documented in 4 of our patients, which was managed with hormonal therapies. So just coming on to the discussion, retinoblastoma is a highly curable neoplasm in high-income countries, but in stark contrast to lower-income countries where most patients present with disseminated metastatic disease. And the evolution in the conservative treatment has gone from local to eye-directed therapies such as EBRTs towards systemic chemotherapies combined with aggressive focal therapies. So just to conclude, the only thing that a study found was that it highlights a high globe salvage rate that was achieved with patients who received radiotherapy, but yes, it is been associated with more complications. However, we do say advanced stage retinoblastomas have higher chances of globe salvage if they were given timely radiotherapies. Thank you.
Thank you. And a quick question. You had group B, D, and E eyes in which primary radiation was given.
No, sir. Primary radiation, just a second.
Sure.
Yes, sir. We gave primary radiation in group B RBs. 1 eye was group B, other eye was group D.
Group A?
Group D.
D.
Yes, sir.
Why would you not think of, we've just gone through multiple talks of IAC, IVC, systemic chemo with
Yes, sir.
focal over radiation over systemic or focal or intra-arterial, given the side effect profile of systemic and intra-arterial is so much lesser compared to radiation to the whole eye.
So that was the purpose of the study. This is a retrospective analysis that was done as to what the primary surgeon was trying to do retrospectively, and then we decided to find out what exactly were the complications that happened.
All right.